And first of all, one broad category is autoimmune conditions. So you can look at, all these immune dysregulation like lupus, rheumatoid arthritis, psoriasis, or even diabetes. There's autoimmune component. So a lot of these autoimmune conditions, because the stem cells have been known. So when we talk about stem cells, there's so many different kinds. So really, I'm mostly referring to mesenchymal stem cells. These are the type of cells that actually are in our body all over, anywhere we have blood circulation, there are these stem cells, but they do dwindle as we age, to almost non-existent, when we reach our 80s. So they kind of go, a straight line down in their decline in numbers. So when we give the body these signals, these cells have the ability to change your immune system. So it can shift the system from a very inflammatory state to anti-inflammatory and regenerative state. And because a lot of these conditions have to do with inflammation, dysfunction, so your immune system has not been able to allow the body to shift out of that inflammatory condition. So these cells are very, very powerful in that sense. But the cells have all kinds of other capabilities, including things like anti-cancer properties, antimicrobial properties. It help nurture the formation of new blood vessels. So keeping up the blood supply. It also can protect dying cells when it can be saved. And it also has the ability to, of course, calming inflammation. So huge in anti-inflammatory condition, but also produce this local effect where it can communicate with the local environment. So it can bring about the right element from the immune system, either to take away bad cells or to, send the signals so local cells can engage in proper actions for regeneration. It actually talks, these mesenchymal stem cells talks with the local stem cells. So we all have tissue specific stem cells. And we are able, so these cells are able to send these local cells like livers. In the liver, you may have liver stem cells. So these cells, if you don't have the correct signals, it may not, may just sit there and not really engage in any reparative, regenerative actions. But these stem cells was almost like speaking their language. So it's, let's say Portuguese, it's speaking just the right language. So the cells are like, okay, now I know. So that's the range of action. So when you ask for 5 conditions, autoimmune is a big category. And we can look at, COPD. I've seen great success in my patients. These are very, very difficult conditions. People are stuck on medications and oxygen, but, I've seen people getting off oxygen and getting off medications and liver conditions. And then, of course, things like osteoarthritis, which really is a systemic inflammatory condition where your body cannot keep up with repair. So I've seen stem cells just doing miracles, saving people's knees, either from chronic, severe debilitating pain or saving them from getting any kind of knee replacement surgeries. So really the research results have, shown from head to toe, lots of great benefits because of the broad range of actions. It's really because of how these cells work. That's why if you have a condition that has high inflammation as part of the picture of the disease, and they have immune dysregulation, then there's a good chance that these cells, because of how they work, that they can help promoting the repair.